the All of Us research program is a national effort to create the most in-depth and largest study that has ever been done. A resource that has more diversity, more clinical data, and more genetic data than any other resource that has ever been created.
If you are a researcher that wants to look at diverse populations, participating in the All of Us Researcher Workbench is where you're able to do that.
We're combining both biological data with data around social determinants of health and environmental and lifestyle.
Things like healthcare access, socioeconomic status.
We're getting ready to expand the data set to include genomic data on a large number of our participants and some data around the COVID-19 crisis. And over time, the data will expand and get richer, and it will start to track the lifespan of individuals in our study.
I was very interested in the diversity of the patients and individuals who are represented in the database.
Latinx communities, African American communities, all of which are underserved with respect to research.
And that data has undergone some transformation to ensure privacy protections are in place for participants.
It's not complete if we don't also really emphasize the access to the data and that the communities themselves can, represent their own health outcomes and interests through researchers from within those communities.
Certain communities may carry a disproportionate burden of disease, but without researchers from those same communities being able to ask the most relevant questions or being able to access that kind of data, it can be very difficult to make advancements.
We know how important it is for our populations to be involved in this research.
A researcher can get access to the tools and the data they need to conduct a project with our resources in as little as 2 hours once their institutional data use agreement is signed.
There's a publicly available data browser to see whether All of Us offers data related to the condition or populations of interest to that particular researcher.
We're building this for researchers from across the spectrum, from all levels of their career, from all institutions. We're bringing them to the table. We're designing it with them.
Anytime I asked a question, the support team would get back to me very quickly. They're adaptive and responsive to feedback.
It's key to understanding how we can improve, what data elements we should consider prioritizing, what analytical tools we should consider prioritizing.
It's really critical that we bring folks to the data, make it easy and accessible to them, and allow all of the brightest minds within this country to be able to ask the questions that are so important.
Collaboration is absolutely critical. It opens new doors and creates new ideas, new perceptions, and new interpretations of data.
We're creating a community of researchers. Our data set could be the place that people meet.
That was the aha moment, is that my idea doesn't have to stop with me. Even if I may not be the person that does the analysis or knows how to do all of those sort of things, I do have the idea. I have the concept. And so I feel like that collaboration between researcher and with a community-based, as I call myself, researcher, that science team is very, very important for our communities.
I look forward to seeing more opportunities where we can leverage the interest of our research community as well as things that are going on that may affect our participants.
The promise here is equitable access to data, equitable access to information that can help in the careers of researchers with the most diverse and participant-forward precision health study to date.
The All of Us research program will be the first step in generating new discoveries that will translate into patient care.